I had just come back from London and I was with my granddaughter, who was 2 at the time. So I knew that I was going to get a cold. As the cold was getting better, I started feeling worse. And I really don't know what the heck was going on. So I took Aleve, Advil, and Tylenol. Didn't even touch it. I couldn't roll over in bed. I couldn't get out of bed. I couldn't take a shower. I couldn't drive. I couldn't turn my head. I couldn't brush my teeth. I couldn't do anything. So I went to a rheumatologist because I had never been to a rheumatologist before. And as soon as she was listening to my symptoms, she said, I think you have PMR. I said, what the heck is that? What is PMR? Polymyalgia. Okay. And she put me on a steroid, which I really didn't want to go on because I had heard such bad things about steroids, but I did go on it. And she started with 15 milligrams. And I thought that was a low dose, but later found out that it was a high dose, but okay. And she's tapered me off. In the very beginning, I went every 4 weeks. And then later, as I got better, I went every 6 weeks. But in the 4 weeks time, she would taper me down to the 14 milligrams, 10 milligrams. She would taper down the prednisone until where I am now, where I'm at 1 milligram, which sounds like nothing. But my fingers and my hands and my wrists are starting to hurt again because I asked her, one thing I asked her, is this going to be forever? You know, am I going to have these symptoms forever? And she said, well, it depends on your body. It depends on how your body reacts to this. I don't know, you know. And now that my hands are starting to hurt, I wonder if it's going to come back or I'm going to not be able to move. And she just doesn't know.
Thank you so much, Linda. My name is Dr. Shilpa Venkatachalam. I'm the Director of Research Operations and Ethical Oversight of Patient-Centered Research at the Global Healthy Living Foundation. And we are delighted to have received this funding from the Centers of Disease Control and Prevention, the CDC, to really improve and build capacity for education and awareness efforts, which are really critical to advancing care and improving outcomes in this disease, polymyalgia rheumatica. And it is our honor and privilege to be working with a team of clinical advisors, you'll be hearing from one shortly, and patient advisors to really advance understanding in this area so that we can lessen, eventually the hope is to lessen disability and morbidity from PMR, improve lives, and reduce indirect and direct health-related costs of PMR on the healthcare system.
Hi, I'm Dr. Anisha Dua, an associate professor at Northwestern University in Chicago. I'm really excited to be here today as part of the advisory group of physicians doing this new PMR project that is extremely important. It's really a natural extension of the Pain Spot project that we initially worked on to try to identify patients with PMR and bringing to light this really important disease. I think that physicians are gaining an increased understanding of PMR. I think that there is a lot yet that's still unknown about this disease, despite the fact that it can be extremely debilitating. I think there's definitely questions that physicians have in terms of what options they have to offer patients for treatment of this disease. I mean, historically, and even still, we've really used a lot of glucocorticoids or prednisone in terms of managing the patients. So I think there's a little bit of a knowledge gap, perhaps, in terms of what options might be out there to control the disease. But also, I think one of the most difficult parts is identifying the disease in patients, because there can be different presentations, and there's no one blood test or one imaging study or one tool that you can use to say 100% with certainty that this is the diagnosis and then know exactly how to manage it. Each patient comes in a little bit different.
I think what could help is a different kind of medication. I really hate being on steroids because I'm so concerned about gaining weight, and you just hear really bad things about steroids. Weight gain is the one that I hear most of the time, but I think the treatment is working really, really well. With the steroids definitely working well. My concern is, will it happen again? Will I have a flare-up when I stopped the steroids, and I'm going to stop, I think in about 4 weeks, I don't know if she's going to stop it altogether or she's going to have the 1 milligram of steroid to go forward. I really don't know. But my big concern is am I going to have a flare up again? Are the symptoms going to come back?
I think that the more that we learn about the disease, the better it's going to be, of course, for patients. As we learn more about the pathophysiology of the disease, we can identify better targeted treatments. We can try to figure out risk factors for developing the disease, risk factors about who might have relapses or more refractory disease courses. And that will, of course, impact patients. So I think it'll be really impactful for patients as we learn more about even imaging modalities and other ways to try to assess disease activity. They'll have more confidence in our ability to guide them in their therapeutic management of the disease. I think there's a lot that providers need to recognize about PMR. First of all, it's one of our most common rheumatologic illnesses. And I think one of the more difficult parts is that a lot of the specialty management happens in rheumatology clinics, but it can be a long path before the patient actually gets there. And so when they're presenting to their internist or their generalist, who's managing many of their other problems, perhaps, diabetes, hypertension, all of the other stuff, it can be difficult to tease out, is this osteoarthritis? Is this a rotator cuff tear? Is this rheumatoid arthritis? Or is this really polymyalgia rheumatica? And they don't always have the time and the tools and, the training in trying to tease out those differences. A lot of times people feel really quite miserable. It's usually pretty sudden in onset, either over days to weeks, and people feel really quite miserable. And so when they come into the physician, they'll note those different feelings and symptoms. And then I think it's up to the physician to try to evaluate, of course, what's going on. And unfortunately, unlike a pneumonia where you can get a chest x-ray and see the pneumonia and then treat it, with PMR, there isn't one specific test that says this is 100% the diagnosis. And I think the pathway to diagnosis for patients can be really variable depending on whether they come in with those classic presentations and someone's quick to recognize it and put them on appropriate treatment, or whether they're going for a while in a good amount of debilitating pain before it's really picked up on, what exactly is going on and how should we treat it. So it can be probably a frustrating path, I'm sure, until they kind of get the diagnosis and get started on appropriate treatment.
Through this grant, we hope to build capacity for education and awareness efforts, which are really critical in advancing care and improving outcomes in this disease, polymyalgia rheumatica. We need to act with urgency. We know that there are diagnostic challenges, including misdiagnoses, underdiagnoses, and hence delayed treatment leading to worse outcomes. Now, in order to address these challenges, which are admittedly present on both sides, the physician side as well as the patient side, and also in our research landscape, our public healthcare system, we think that a citizen scientist approach is warranted. And so this project will bring together physicians, researchers, and care partners, patients at the level of the healthcare systems, communities, and populations. By doing that, we will create opportunities to better diagnose PMR, define measures of disease activity, understand responses to treatment, and improve clinician and patient-reported outcomes and population-level outcomes. So we know that PMR, or polymyalgia rheumatica, is a chronic inflammatory rheumatic condition and causes substantial disability for those living with it. PMR, we know, affects around 800,000 people in the US. Now, interestingly enough, epidemiology studies that tend to be more representative, they don't really address PMR specifically. Instead, they include it in a catch-all category, like, for example, rheumatic and musculoskeletal diseases. So there is a very high and urgent need for more research into PMR. And just to put this in context, I'll give you a staggering statistic. So we conducted a preliminary search on July 1st, 2023, very recently, on PubMed, which is a medical research publication database index, right? Using PMR as the search term. And the return was 2,900, so close to about 3,000 English language articles. 3,000. Now compare this with rheumatic arthritis, a disease that is less than 2 times as prevalent, that returned 60 times more English language articles. That itself is evidence enough that more research is required in this area, more education is required, and awareness building is crucial. We don't even have information on disability-adjusted life years for PMR. Again, this reflects the urgent need for more research.
I think we're in a really exciting time for PMR. There's a lot more research in the area right now and a lot more collaboration about getting a better understanding of PMR. So we're going to be able to, and already have started finding more directed therapeutic targets. And so that's going to allow us to hopefully treat our patients more effectively, offer more hope for patients who have refractory or resistant disease, and hopefully decrease the glucocorticoid burden so that patients will have less side effects from chronic use of long-term steroids, which we all know a lot of our patients hate. They have a lot of comorbidities. This is an elderly population, and we're telling them to take, even if it's a lowish dose of prednisone, we're telling them to be on it usually for quite a long time. So I think there's hopefully a lot of improvement in terms of our therapeutic options and also risk stratification. So I'm excited that that's happening.
So as an organization that is committed to doing patient-centered outcomes research in chronic disease through our Omni Disease platform called Patient Spot, our aim is always to support the patient community and the physician community with evidence-based information, and in many cases, of course, education combined with policy recommendations. The low levels of research into PMR, the need for improved diagnoses, missed opportunities to improve treatment support, all this indicate an urgent need to drive awareness and education for PMR. The Global Healthy Living Foundation is grateful to the CDC for providing us support, without which we could not have done important work in this area.